Welcome back. Tonight we are digging deeper into the opioid epidemic for you. More doctors now recommending safe alternatives to treat pain.
WATE 6 on Your Side reporter Amanda Garcia visited a pain clinic to look into the benefits and financial barriers of less addictive treatments that you might want to consider.
Every year, thousands of Tennesseans lose their lives to opioids.
He took them and quit breathing, and it was too late. It's been about 2 years ago I lost a nephew to opioids.
A drug overdose, leaving a painful void in Greg Russell's family. Pain is something this Maryville man knows all too well in its many forms.
I had one knee replaced, had 2 back surgeries, shoulder surgery, I've been in a lot of pain.
6 surgeries over the span of 8 years. Every time Greg recovered, he relied on painkillers his doctors prescribed.
Thought I had to have opioids, to get through the night, and I can see how they can be addictive.
Seeking relief, Greg came to pain consultants of East Tennessee.
Whenever that nerve is being irritated, it swells up.
Immediately, Greg's back felt better after a steroid injection.
We injected here with a long needle.
The Institute of Medicine says currently it's estimated that 116 million Americans live with chronic pain, which can severely limit a person's quality of life and may even interfere with the ability to perform daily activities.
The patient comes in with a particular problem. We have to figure out what's going on. We really try to focus in on doing everything except opioids, leaving them as a last resort.
While prescribed opioids are appropriate in some cases for patients,
there are some folks, if they use the meds responsibly under expert care, that can benefit from some modest amounts of opioids. But you have to be very careful.
Opioids can mask the sensation of pain, and that's why doctors say it's not always the best option for a patient. They say that there's alternative treatments like physical therapy and other methods that can be safer.
One of the most common reasons for patients to come in to see us is because of lower back pain and sometimes leg pain as a result of a pinched nerve.
Dr. James Choo says choosing non-pharmaceutical treatments can eliminate the risk of misusing opioids and avoiding the potential negative side effects. But typically, these safer alternatives come with copays and deductibles, making it expensive.
Insurance may not cover those therapies. Unless you can afford to pay for those out of pocket, you don't have equal access for folks.
Karen Pershing with Metro Drug Coalition says that shouldn't stop you from looking into your options.
A prescription may be less expensive, say, than doing an acupuncture session or multiple chiropractic visits. But in the long run, we've been able to demonstrate through research now that if people stay on opioids for a longer time, they end up costing us more in the long run.
Pershing says there needs to be a conversation about changing coverage policies for people in pain to get the best possible care. In the meantime, many providers already cover non-opioid pain management to some degree, but oftentimes they're limited to the duration of services. And some doctors are willing to set up payment plans for patients without insurance. Reporting in Knoxville, Amanda Garcia, WATE 6 on Your Side.